So we got either the TH1 or TH2 dominance when it comes to allergies. The TH1, as you can see, is mainly the cell-mediated response that involves things like the macrophages, natural killer T cells, helper T cells, cytotoxic T cells, etc. And then the humeral response, the humeral immunity, involves the complement system. So it involves neutrophils, B cells, plasma cells. That should make things a little bit easier if you just look at it that way. Remember, the entire immune response can be a little bit involved. We really want to look at liver function. It's the liver that's helping to produce a lot of the immune response with basophils and bradykinins and something called histamine. So it can get a little confusing. The other thing that the liver will do is it'll work with the adrenal glands to a large degree. The adrenal glands have chemicals that they release into the bloodstream that are hormones. These hormones are called aldosterone and cortisol. So aldosterone will increase inflammation in the body, and cortisol will decrease the inflammation in the body. These things are pretty involved. I know you're probably watching this if you are a healthcare provider, especially if you're involved in immunology. This all may seem, some of it may actually seem really interesting to you because we get a chance to talk about the herbs that you're not familiar with, and we're also mixing in immunology with physiology. But of course, this is extremely simple for somebody who's an immunologist. They're just looking at this as some kind of a joke, probably, if you're watching this right now, because this is such a simplified version of, the actual discipline of immunology. So let's say that you have a patient that falls into one of these two immune responses. You can actually choose, if you would like to follow through with some of these chemical therapies with that patient based upon the type of immune response they're having. Let's talk about that again in a minute or two. So the first thing that I want to share with you is that we have certain diseases that fit into the different immune responses as well. Let's focus on the autoimmune diseases for a minute here. And we'll take a pen. And we'll first go over TH1, and then we'll go over TH2. Again, this is supposed to be for the layperson. So if you are an immunologist or something, you don't have to send me emails and give me a hard time or anything. Just let's focus on the people who are maybe not healthcare providers. So with the TH1, we're going to use maybe a different color. I like red. We'll use red for different diseases. We have the diabetes, it's TH1. And then we have multiple sclerosis. So we're talking about diabetes type 2. It's easier for us to talk about that one. Diabetes type 1. Okay, the medical profession has convinced everyone that diabetes type 1 is not a reversible disease, and I don't agree with that. So I've seen patients who have diabetes type 1 do great. It's a tough disease to treat, let me tell you. I mean, it's just such a deeply it's in every part of the person's physiology. But basically, their pancreas is no longer putting out the insulin, so they're taking it either as a pill or injections. But once they get the pancreas healthier and they're able to decrease their injections, they can start to get the pancreas to once again put out the hormone it's supposed to with the proper therapies. Now the question is, of course, who do you go to get these proper therapies? And is this going to do it? Well, you need to find somebody who's highly trained. Again, I'm using these therapies, a combination of neuro-emotional technique, total body modification, and professional applied kinesiology, and a variety of other structural, chemical, and emotional therapies, and a dynamic system called the Triad of Health chiropractic kinesiology system of diagnosis and treatment. It's just profound. So I'm not really intending to brag. I'm just saying, because I have all these therapies at my disposal, I actually am able to help these people who are that sick improve. And it's not a quick fix. People with diabetes type 1, it can take a couple of years for them to really respond to care and turn their disease around, but it's something that can be done, is my point. It's not an undoable thing. It's not impossible. See, there's an old expression, and that expression is, those people who are telling us it can't be done are just upsetting or those people who are doing it. In other words, real simple, that's real straightforward, right? Those people who tell you it can't be done, those people who are saying things can't be done a certain way, are just angering and frustrating and annoying those people who are actually doing those things that they're being told cannot be done. And so that's just happening in all different professions and in all different areas of life. So I'm sure a lot of people told Bill Gates he couldn't develop an amazing software that he could then market and get the whole world using, but he did it. I mean, he did it in a profound way that we all know today as being Microsoft and Windows. So okay, so we have Hashimoto's. Viral infections tend to be TH1, and then we have mold infections. Okay. Let's go over to look at TH2. TH2, we have lupus. Lupus erythmetosis. It's really a blood disease. It's when a person's allergic to their own blood because they're not happy with themselves. So notice how I always bring in the emotional component to these diseases. The bottom line truth about health and ill health, disease and whatnot, is that the underlying cause of most disease is emotional, spiritual, mental. Okay, it's not so much just something went wrong and we don't know what it is, and the person got exposed to toxins and they got cancer. That does happen occasionally, but the underlying platform of all health concerns really is mainly emotional. Okay, so I just thought you'd find that interesting. Here's great examples. I'd mainly focus on Hashimoto's, multiple sclerosis, diabetes type 2, and lupus. MS being the least of the three, but the least of the four, I mean, but still fairly high in terms of the emotional component to it. So we got allergies. Okay, if we're talking about allergies, then obviously, okay, here I'm referring to like really severe allergies. Let's try to make this clear. Somebody who has constant stomach pain and they've had it for years and years and years. Somebody who has itchy skin so bad that they itch it to the point where it bleeds, and they've had this for years and years and years, over 15 or 20 years. Hay fever, during the springtime, the person's sneezing every single spring. They have all this sneezing, runny nose, watery eyes, that kind of thing. So this is really what I'm talking about. When I'm talking about allergies, I'm referring to fairly severe allergies. So let's put in here asthma. Okay. Chemical sensitivities. It's multiple chemical sensitivities. It's a particular code name for somebody who's highly sensitive to all kinds of things, also known as an environmentally sensitive people. And then atopic dermatitis. Okay, so the only reason I'm doing this is I thought you might find it interesting that these diseases, people have researched them so well, and they've also understand the immune response well enough so that they're actually able to classify certain diseases with the cell-mediated immunity, and then they're able to classify other diseases with the humoral immunity. So I thought that was interesting. You know what we haven't talked about is, let's say a person's switching back and forth between both types of immune responses. They're switching back and forth between the TH1 dominance and the TH2 dominance, between the cell-mediated immunity and the humoral immunity. If that happens, then what do you do as a clinician, and what do you do as a healthcare provider if you're wanting to help them? Well, do you just switch back and forth the nutrients? Because the person can switch between TH1 cell-mediated and TH2 humoral mediated within just a day or two. So, what do you monitor them every single day? No, not necessarily. So, as it just so happens, there are certain nutrients and herbs and whatnot that can help support both types of immunity, according to the research. Actually, one of my favorite herbs that I didn't mention before would be grapeseed extract. So grapeseed extract is really great for viruses. So it seems like a fair number of my patients benefit from grapeseed extract. The other thing about grapeseed extract is it helps with circulation, which helps with brain function. It helps oxygenate the blood to some degree, and the brain to a larger degree. Okay, so it's just really, it comes up a lot. It helps reduce toxicity. It's an antioxidant. You get the idea. So that seems to come up for a fair number of my patients. Okay, so what nutrients support both TH1 and TH2 dominance? I love these different colored pens. They just make my job a lot easier. Okay, so we have TH1 and TH2 support. Okay. So if a person, so you know what we're talking about, of course, that the clinician who's helping their patients may want to be careful if all of a sudden a person is being supported with stimulating TH1 immunity, and then all of a sudden their patient switches over to TH2 dominance, then they're supporting the wrong type of immunity, and the person will get more sick rather than healthy. And that's not great, right? That's a big problem. So let's go through a whole list of nutrients that'll support both. Yay! Okay. Vitamin D. Glutathione. Superoxide dismutase. Superoxide dismutase. Vitamin B2, which is riboflavin. Vitamin B3, which is niacin. And fish oil. There's all types of fish oils. It's the way we work at Triad of Health is we diagnose the need, supply the need, and then observe the results. So we don't provide any therapy unless we're certain it's going to be effective ahead of time. And with all of the different methods of diagnosis that we have available to us, from all the extra training we have, we're able to really hone in on exactly what therapy is best to use for what patient at what time in what order to get the maximal result. That's called critical point analysis, by the way. Okay, it's sort of outlined in a book called Consilience by Edward O. Wilson, if you want to learn more about it. So fish oil, there's a lot of different kinds of fish oil. I mean, there's cod liver oil, there's basic omega-3s, concentrated, not so concentrated, and then there's a company that I use their product, which is a shark liver oil. They have shark liver oil in capsules, they have shark liver oil just as their regular liquid, and so you get the idea. So there's different kinds of fish oils to be used for different things. So I'm trying to think if there's also Phosphatidyl Serine. That really supports brain function along with the omega-3s, right, the fish oils. And then there's vitamin B1, vitamin B2, we went over that. There's coenzyme Q10, which is part of the Krebs cycle. And then there's alpha lipoic acid. Okay, alpha lipoic acid is also part of the Krebs cycle. I laugh because, you know, you get these nutrients in foods, right? You're supposed to just eat the stuff, digest it, absorb the nutrients. They should be available at the cellular level and in the blood. And then why bother taking the nutrients? Some people's digestion, of course, isn't working so great, then they need the nutrients. Speaking of which, why would a person's digestion not work well? Why? I mean, what are we really doing here? What is all this about, you know? This is about getting people healthy so they don't need to take a bunch of nutrients for the rest of their life, okay? That's what we're supposed to be talking about here, just to clarify. So, if we're talking about allergies, what we need to consider is what is causing the allergy? How do we get rid of it? How do we keep it from coming back? Okay? So we want people to get well and stay well. This is huge. I know you're watching this for 18 minutes. Thank you so much for your patience. But let's get to the point, even more so than we already have. Allergies are caused by a person who is just not responding well to stress. So they have 4 kinds of stress. Structural, we've talked about it in the videos, right? Who I am, what I do, and why I do what I do. Watch the 1 or 2 or 3 videos on that. So there's structural stresses, chemical stresses, emotional stresses, and thermal, meaning temperature stresses. Those are the main stresses according to Hans Selye, the world famous Canadian medical doctor who found out about the problems with the adrenal glands and how it leads to all different types of disease. I mean, the guy is just, he wrote a bunch of books about stress and adrenal dysfunction, so maybe you'll get a chance to look them up. So stress. So stress is affecting, what we found for allergies is it really affects the adrenal glands and the liver dramatically, to the point where the adrenal glands aren't putting out the chemicals properly that get rid of inflammation or increase inflammation. And then the liver won't do its job to put out its histamine and basophils and the things that it's supposed to do, bradykinins and the chemicals needed for a proper allergic response. I mean, it's just not, it doesn't work out properly. Allergies are always going to be caused by the same thing that other health concerns are caused by. Not healthcare, other health concerns are caused by. And those things are not enough water or poor water metabolism. So dehydration. The wrong kind of water, a person is often drinking the wrong kind of water, or they're not drinking enough water, or they're drinking the right kind of water and they're drinking enough, but they're not drinking it often enough. Okay, so water is really important. Most of these cells that are being supported by either the TH1 or TH2 response are cells that have a whole bunch of water in them. I mean, that water is necessary. That, you know, there's 75% of these cells are made up of water. These are protein cells too, you may want to know. So there's all kinds of phospholipids, Phospholipid meaning it means fat mixed with phosphate. Phosphate is like an energy molecule needed for the Krebs cycle to complete itself. The Krebs cycle is a way in which we get food from ATP. But anyway, it gets a little intense going through every little detail because that's not what we're here to do. But all these cells are made of protein. So of course, not only is water metabolism important, but protein metabolism. Water metabolism, water utilization, protein metabolism, protein utilization, okay? Blood sugar, these are the causes of allergies. When these things are imbalanced, people have allergies, for sure. Blood sugar imbalances, sometimes people's blood sugar is too high, sometimes it's too low, sometimes it's both, back and forth. Do the words ADD sound familiar to you? Do the words ADHD, attention deficit hyperactivity, maybe I have it. Okay, ADHD, attention deficit hyperactivity disorders, does that sound familiar? Bipolar syndrome, manic depressive, okay? People who are having trouble with their mood, similar to depression, okay? All of these diseases, including, well, not really including, but to some extent, autism or autism spectrum disorder diseases, these are caused by people who have imbalanced blood sugar. Proper protein metabolism and utilization allows a person to have balanced blood sugar. What else? What else is important when it comes to allergies? Well, I'm glad you thought you'd ask me about it. Poor digestion. Digestion, yeah, there we go. Get it on the video there. What causes poor digestion? Well, a poor terrain, meaning it's a bad environment in the digestive tract. It could be too acidic or too alkaline. The other thing that causes poor digestion that's very, very important would be pathogens. So things like viruses, parasites, bacteria, mold, yeast, fungus, candida, spores, mycotoxins. We'll do a whole other video on that for you, okay? Okay. So we want to look at the terrain of the gut. We want to look at the digestion. We want to look at blood sugar. We want to look at dehydration. And we want to look at, we want to look at these things, protein utilization, right? Okay, so these are the things that if they're off, a person will have allergies. And the main reason why a person's having trouble with their digestion, the main reason why a person's having trouble with their blood sugar, the main reason why a person's having trouble with their protein utilization is because their stomach doesn't work. The stomach is the first major line of defense after you chew your food and break it down with the saliva and the teeth, the mechanical chewing process. So if a person's stomach isn't working, they never feel good. I mean, they just feel like terrible all the time. They feel like crap all the time, okay? They can't get the proper protein to be broken down and utilized and made available and absorbed in the small intestine. They can't get their blood sugar to stabilize because after all, the protein stabilizes the blood sugar. And they can't get rid of the infection that they may or may not have, or the agents that are infective agents that are in all food, because their stomach doesn't maintain enough acid. Guess what? You can't make stomach acid without zinc. So zinc is very important. Okay, we can just add zinc to our list that we were making here, because zinc will really support both TH1 and TH2 dominance. Okay, let's put that in here. Zinc, nice and big. Zinc. Okay. Does it matter what kind of zinc you take if you're needing help with low zinc levels, and for some reason the structural, chemical, and emotional therapies are not effective enough to get rid of the zinc deficiency without prescribing zinc? Yes, it matters. It matters what kind of zinc you take. So we try to use one that supports the individual patient. Now let's get even more into why this is so important from a matter of fact, just purely logical reasoning perspective. Let's just use logic and reasoning here. because I love logic and reasoning. See, if you look at all of these different nutrients and how they're going to help a person with both TH1 and TH2 dominance, and if you look at the possibility of all these diseases and how you're going to treat each one, and you just kind of look at the different herbs that or chemicals that might support either TH1 cell-mediated immunity by really stimulating that type of immune response, or TH2 humeral immunity to really stimulate that type of immune response. And if you just look at what the two are, you know, what's the difference between the two? What we're seeing is we're seeing so much information and so many concepts all at once that whether you're a healthcare provider or not, whether you're trained or not, whether you're a layperson or not, whether you studied immunology or not, whether you're a medical doctor or not, whether you've been in medical school or not, whether you've studied physiology or not, it just becomes a little bit inundating if your goal is to help somebody with diabetes type 2 no longer have diabetes. If your goal is to help somebody with multiple sclerosis no longer have multiple sclerosis. If your goal is to help somebody with Hashimoto's thyroiditis no longer have Hashimoto's thyroiditis and be able to afford your therapies and continue with care long term, it's going to be just really, really challenging unless you know what you're doing and you got a great approach. So here's the key. We don't treat symptoms at Triad of Health Family Healing Center. We don't treat these diseases. We treat the person who has the symptoms. We treat the person who has the disease. We treat them structurally, chemically, and emotionally. We have hundreds and thousands of therapies with which to choose from to do so with. We don't treat diseases. We don't treat symptoms. We don't treat diabetes type 2 or multiple sclerosis or Hashimoto's or viral infections or mold infections. We don't treat lupus, allergies, asthma, chemical sensitivity, atopic dermatitis. We don't treat dehydration or protein utilization problems or blood sugar imbalances or constipation or any. We don't do that. We treat people. We have people who come into our office. We treat the person who has the trouble with protein metabolism. We treat the person who has the trouble with dehydration. We treat the person who has the disease. We don't treat the disease. It's a lot more than a matter of semantics. Treating the person is completely different than treating the disease. Treating the person means we work to shift the person's metabolism. We change their body. We alter their physiology. We modify who they are. We change everything in their life. We change their relationships. We change how their energy is. We change the environment that they live in. We change the type of food that they eat. We change the type of personal care products that they use. We change the type of air that they breathe. We change the things that they come into contact with. We change the people that they come into contact with. We change their finances by helping them to make more money when they're healthier and they have more energy and they can think more clearly and they're more competitive at the workplace and they're getting sick less often. We change every aspect of a person. We treat people. We don't treat diseases. But we do treat people who have diseases. And by treating the cause of the disease, by treating the structural, chemical, and emotional causes of the diseases with a therapy that's best for that person at that time, at that moment, that'll give the best results, miracles happen when we do that. See, we don't treat a TH1 response. We don't treat a TH2 response. We treat people. We treat people. And we have therapies with which we can do that with. If a person has trouble metabolizing protein, we treat it. It's important. If they're dehydrated, we get them drinking more water. And if they can't utilize their water, we get them utilizing the water better. We completely change how their body works. The therapies do that. They're designed to do that. We have a lot of different therapies for a lot of different kinds of people. That's why also we have different payment plans. We have like 11 affordable different payment plans, and we have complete different programs for different kinds of people. I mean, It's profound, really, it is. So I really appreciate your watching the second part of the allergies here. It's been a long part 2 video for you here, and you hung in till the bitter end, and I want to reward you for that somehow. At least you're finding out about this, and maybe that you could think of that as a reward. So thanks a lot, and so while I appreciate that these things are available in healthcare, we're light years ahead of this type of science, where we want to nitpick and look at each little part of the body. We just change the body, and all these all these things change. We change the immune response quickly without needing to give nutrients most of the time. Have you ever heard the expression, it's the acupuncturist who uses just one needle and one herb who is the master acupuncturist. It's the acupuncturist who uses 25 needles all over the body and 5 or 7 different herbal formulas, each containing 15 or 20 herbs, who is the novice. It's the acupuncturist who can't figure out what to treat and can't pinpoint exactly what's causing the health concern that has to use all these different therapies. It's the one who knows exactly what's going on that just hones in on using just 1 or 2 therapies. And that's the difference between a really skilled practitioner who's honed their craft and a beginner. So thanks a lot for coming out. Thanks for watching our allergies part 2. And we'll see you at the next video. Thank you.